And I hope last time you understood some whatever I wanted to tell you something about. A lot of questions were asked, and I hope you understood those questions, those answers. And there were few questions which I could not answer because of shortage of time. So if those persons are there, you can always ask the question again so that we can start the session. Welcome, Dr. Amulya. So today I'll just discuss a recent case which I did very well with the remedy. Good evening, and let us start the session. So before everybody joins in, let me tell you something about very interesting symptoms. Welcome, Dr. Vishaka. There was a case where the patient, had a lot of anticipation, and then because of that, he used to go in a lot of depression. So a simple remedy, if you see the remedy, there are a lot of remedies in this, but whenever there is a depressing emotion which makes him go under the spiral wave, so whenever there is elements from depressing emotions around him, the news is always depressing, around him the news is always bad, there is a very interesting remedy with a lot of anticipation and a lot of foreboding. Which remedy? You start answering it before I take a question. So please share some remedies for otorrhea. Good evening, Dr. Anja Smith. Good evening, Dr. Trivedi. I'll tell you something about otorrhea, but let us understand this remedy. It was a very short case taking, and I found any depressing emotion and the disease starts. A very important remedy for a lot of anticipation, for a lot of foreboding, for a lot of presentiment. The patient become dull, depressed, every time going on the spiral wave. So metronym has other qualities also. It's very important. Metronym has other qualities also, but this is a very easy remedy. We normally fail to understand this remedy because of there are so many other remedies for these conditions. So I prescribed the patient a very simple remedy, that is gelsemium 1 mg single dose, and the patient was feeling much better. He came today after 5 days of gelsemium 1 mg and he was much better, though the emotions are depressing, though he feels sometimes that how he cannot feel that depression. He was also surprised. So the gelsemium single dose treated that case very well. So I just wanted to tell you something, that it is not always that the same remedy, the same elements from the same symptoms you take, like gelsemium, you always take that elements from anticipation and then heaviness of the eyelids, and those are there. But look at the other side of mathematic also, and you will find that there are so many remedies, which have in its pathogenosis, in its mathematic, in its symptom, which can be used in different aspects of our life. For example, if you have seen my YouTube videos in relation to skin, I had a lot of queries about skin symptoms. So I have taken a series of YouTube videos on skin, and I have only spoke about the polycrest remedies. I think yesterday I talked about lycopodium. Lycopodium is there, natramur is there, sepia is there, calcarea, kalika. I have told so many remedies, and please go to that YouTube video so that you understand that how many remedies basically we prescribe. In fact, I had a very interesting case where that's why I spoke lycopodium, that there is a boil on the patient's hand, and the boils have lot of openings, pus discharge everywhere and all. So basically what happens, boils with pus discharge, we normally think about hepatic sulfur is there, silicia is there, sulfur is there, a lot of remedies there. But if that boil has lot of openings, there is only one remedy, and that is lycopodium. So these are very important symptoms of the remedy which you should remember. Like for instance, cracks on the hands after washing. Now whenever the word washing comes, we think about sepia. But there are other remedies like calcarea is there, lycopodium is there, natrum is there, lot of remedies are there. So whenever you are prescribing a remedy, make sure that you know the remedy in whole, so that you are not able to miss out those symptoms. For example, I told you something. See YouTube video. Welcome Dr. Mayur, Dr. Indranil, Dr. Babels, Dr. Patra, Dr. Bilwalkar. So if you go and see my YouTube video, Dr. Patra, I think the link is Grace Healing Homeopathy, and you can watch all the videos. In fact, if you see gelsemium, I'll just tell a few symptoms of gelsemium, and then I'll answer the question of Dr. Amulya of otorrhea. In gelsemium, remember one thing which is very important. There is fear of death and there is lack of courage. There is fear of death and there is lack of courage. This is very, very important. No? So we have bad effects of fright, we have bad effects of fear, bad effects of sudden emotions. That is also gelsemium, because whenever there is bad effects of sudden emotion, we normally think about cough. Do think about that, but think about gelsemium and think about ignitia also. These are very, very important symptoms apart from that lack of muscular coordination. And one symptom of gelsemium headache, you should always remember that headache of gelsemium is most of the time preceded by blindness. Remember this symptom, most of the time it is preceded by blindness and ameliorated by profuse urination. This is a very, very important symptom of gelsemium. Headache better by profuse urination. Okay, I'll not again start gelsemium because it will take a lot of time. Before that, I'll ask some questions I've scrolled up. So, some remedies for otorrhea. Now, whenever you're prescribing some otorrhea, of course, there are so many remedies for otorrhea. But let me tell you, there are a few remedies which I have found very, very useful in otorrhea, Dr. Amulya. The first, of course, don't forget sulfur. Don't forget mercury, Merxol. Don't forget calibichrome. Don't forget calcareous sulf, and don't forget conium maculatum. These 5, and silicia and pulsatilla. These 5 remedies are very, very useful, and you will see in a lot of cases you will get these remedies. Of course, there are hundreds of remedies again, like we have. Then second grade remedy, we have nitramur is there, CPI is there, Rustox is there, Bryonia is there, lot of drugs. But I would like to tell you something. Whenever you are asking a symptom, try to define the symptoms. Like we have otorrhea, then left ear, then right ear. Then otorrhea sometimes discharges pus. And how is the pus? It is slim pus, it is thick pus. Then sometimes it is bloody. Sometimes it is excoriating, sometimes it is very fetid, sometimes the pus is greenish in color. So if you try to define the symptoms of the patient, it will have few remedies, and then you will be able to prescribe it properly. Otherwise, otorrhea general, whatever remedy I have told you, those are very interesting remedies. Please add to that Kali sulf also, okay? Yeah, so please share the video I have told you. Thank you. Sir, how to approach in complex disease where 2 or 3 diseases exist together at one time? First of all, if you have read Organon, basically disease, we say it is a miasmatic blowing up, no? From sora to psychotic to syphilis. Whenever you're taking the case, maybe don't go for the disease like that. If the patient is suffering from renal failure, he will have blood pressure, or he'll have diabetes, or he'll have some else disease, See the miasm first, whether it is 2 disease, 3 disease, or 5 disease. If it is a syphilitic disease, out and out full-blown syphilitic disease, try to find out some syphilitic symptoms. Now, it is not always necessary that you go to the syphilitic mind and see the mind of the patient. Sometimes you have a symptom of the disease condition also, which is very syphilitic in nature. Take that symptom for prescription. Don't worry how many diseases are there. Worry about the miasm. See the miasm which is present in that case, full-blown syphilitic or psychosyphilitic or full-blown psychotic or soro-psychotic, and then according to the miasm, take that symptom for prescription, and then you'll be able to treat that disease according to Heinrich's law of cure, from syphilis to psychosis and then from sora. So our approach, basically what Dr. Master Hahnemann has told, is miasmatic approach, and that's how you have to look at the case. Okay. So welcome Dr. Deepika, Dr. Karthik, Dr. Amulya, Dr. Mithali, Dr. Trustov, Dr. Mujahid. So one more. Yeah, dominating miasm. Dr. Disha, welcome. So some symptoms, Dr. Amulya, something about carbuncle. Now, see, whenever you are prescribing a case in carbuncle, make sure that what I have seen in my practice. See the symptom first. See the symptom first. Then you will be able to prescribe. For example, if a carbuncle has lot of burning, lot of sloughing, lot of this anthrax there. If the carbuncle is very discharging, very offensive and very fetid pus, think about sulfur, hypersulf. If the carbuncle is very painful, the ball has not matured, think about silicia. If the carbuncle has many openings, think about lycopodium. So in this case, always try to define the carbuncle, and then you'll be able to prescribe it better. Yeah, welcome Dr. Akshar, Dr. There's a lot of persons in Instagram which I may have missed out. Sir, dominating miasm, yes. Dr. Vaishnav, sir, can a diabetic case turn into non-diabetic homeopathy? Yeah, so first of all, you must be able to at least see few cases of diabetes which have been turned into homeopathy management. Yes, there are some cases in my practice which I have been able to successfully treat with homeopathy medicines. But let me tell you, those cases basically were recent onset, for example, only 6 months, 1 year, or 2 year case of diabetes, which I was able to revert to homeopathy treatment. Second answer, I have few cases which were on insulin therapy, and I was able to stop the insulin and shift the patient to homeopathy medicines, and they are continuing the allopathy medicine, anti-diabetic medicines also. So there is a lot of scope. The most important thing is at what time the patient approaches you for treatment. If a patient has diabetes, he will never come to homeopathy doctor. He'll first go to the conventional medicines. Now, after getting tired from that conventional treatment, will come to you maybe after 5 years, 10 years and all, and that it becomes sometimes difficult, not impossible, to convert the patient to homeopathy treatment. And there are a lot of other things in relation to diabetes. Diet is there, uh, exercise is there. These are very important things I have seen in diabetic cases which have to be followed. Now let me tell you, there are few cases who have directly come to me for homeopathy treatment of diabetes, whose sugars were very high, and they are very well maintained with homeopathic treatment. Of course, with exercise, with diet and homeopathic treatment, they are very well and doing very well with our medicines. There is a soft, slippery message on left sternocleidoid with pain. How we approach the type of case? Soft, slippery mass. Now, see, whenever there is a mass, there is a tumor type of mass, it is a psychotic miasm, no? So whenever there is a psychotic miasm on the sternocleidomastoid muscle, psychosis is there. So always go for the psychotic type of case taking, and psychotic case taking, psychotic treatment first for prescription. Don't always go in these type of cases like give calcarea floor or give phytolic or give ruta or give silicia, like give theosinaminium. These remedies are there which normally a lot of doctors give because it's a tumor, it is गठन आई है और उसको दे दिए, होता है. But I have seen in those cases, case taking with a psychotic remedy and repetition with LM potency, with LM potency works better. So in my case, if you have LM potency, take the case and then it will be better treating those type of cases. Remedies for that. No, see, whenever you are taking a case, see, it is not important that which remedy I have told, which remedy I have been, a lot of people use those remedies for prescription. So remedies like the acute remedies, which basically everybody gives, like calcarea floor is there, theosinaminium is there, phytoloca is there, ruta is there, conium is there, they are there. But if there is tumors in relation to neck, the sternocleidomastoid muscle, 3-4 remedies are very, very important, Dr. Amulya. First is Bratacarb, second is Silicia, third is Natrum Carb, fourth is Sister Scan, and fifth is Bromium. So these remedies basically will give you good result depending on the case taking and depending what symptoms, psychotic symptoms you have taken for prescription. I have, according to my experience, I have used in these cases LM potency with very good results because you can repeat those potencies. Okay. Dr. Niels says, sir, do explain us the technique of administering LM potency in practice. It is very, very simple. If you have read Organon of Medicine, 2 pills of poppy seed put in the 100 ml of distilled water, then give 10 strokes. Take 1 spoon, maybe once a day, twice a day, depending on the symptoms and the susceptibility of the patient. For example, Dr. Hahnemann says LM potency in acute condition can be repeated every 10 minutes, 15 minutes also. And in chronic condition, when the results start, then start tapering off the medicines. If you're giving every day, then taper it off to once in 2 days, once in 3 days, weekly once. For example, I had a case of congestive cardiac failure where the LVF was, I think, 20%. The case was from, I think, Germany, and he had to be put a pacemaker. So we prescribed LM potency, and after 1 month of LM potency, the LVF from 20 came to about 35% or 40%. Exactly, don't remember, but in repetitions. So now the patient is still with me. So I am repeating that LM potency in ascending order. I am giving only once a week now, only once a week. So there is no need for the pacemaker also in that case. So this is how you have to use the LM potencies. Yeah, good afternoon, Dr. Nigwekar. So this is how you prescribe LM potencies, and this is how you interpret your Metermedica symptoms. Yes, any more questions? Few questions have been scrolled up, so you can always repeat it because a lot of, yeah, one question I can see is pterygium curable. Uh, Pterygium is there, no? I don't know exactly. It was there, but it just skipped my mind. Yeah, I've already told you that pterygium. I have few cases which are much better, but still slight pterygium is seen. So they are much better, and I'm still waiting for a cure, and it will be cured. So in homeopathy, one thing is there. If your case taking the remedies right, no, everything is possible. And I can say this with a lot of pride that I last time only told you know that I had a case of lung fibrosis. The whole lung was fibrosed post COVID, and it is 80 to 90% much better. The fibrosis has cleared up. So we could have basically, if we could give the patient a new lung, a new lung in the body itself. So the body will try to heal itself. And that's basically the doctor who called me, who had done that scan, he said that is a miracle. I have never seen that case, a case of whole fibrosed lung come back to normal. So this is basically your confidence and your uh, understanding of symptoms and mechanism which you take for prescription. So that's very important, and you will get it. We did not have so many, we did not see so many cured cases in our life 25 years back, but now you have seen, and I have so many assistants who join me, and they also surprised that they have seen such beautiful cures. So the confidence is very important. Otherwise, uh, you keep on changing the theories, you follow this, you follow that, and ultimately land up in a problem where you don't know anything what to do. Just follow the master, and I think you'll be able to get good results. Okay, like for instance, Dr. Amula said something about what do you call otoria. Now otoria in general would have so many symptoms. For example, one remedy which it comes to my mind is, like for instance, kali bicrom. If there are no questions, I can just extend those answers. For example, I cured a very interesting case of otoria, chronic otoria with kali bicrom. Just okay, what is the best remedy for high triglycerides? See, I cannot tell you. I have never prescribed for triglycerides a very specific remedy. Now, if the whole triglycerides can increase or can be high if the patient has drunk alcohol and tested TG level, or if the patient is diabetic, also the TG level can go up. For second thing, and third thing I have seen, as the TG goes up, the cholesterol goes up. And I had to do something about cholesterol. Whenever I've seen cases of cholesterol, normally most of the cases react to one symptom, that is grief. And if you extend that grief, silent grief, so there's a lot of accumulation, and that's why the cholesterol goes high. Then TG also goes high. So do think about the diet of the patient, what has he eaten before testing. And second, in diabetics also the TG goes high. The specific medicines I can't tell you because I've never prescribed, so I can't tell you specific medicine for that. Sir, please tell some remedies for blackening of face. Blackening of face. Now, yeah, I think you must be telling something about melasma. Now, if you see basically in homeopathy also, if a patient comes to me also for melasma, I am not so happy because I have also what you call results. Some basically recoup well, some do not recoup well, some takes a lot of time. So I am also not happy because these are very challenging cases. But as you have asked the question, I'll tell you some remedies which have given me very, very good results. Blackness in leaves. Okay, not melasma. Okay. Now, as I told you before also, blackness in leaves basically is lack of oxygen. And if there is lack of oxygen, the photosynthesis is not there and the leaves become black. Now, I have not so much experience. I have only few plants in my clinic which basically I give medicines and have got good results. So blackness of leaves, important thing is there. When you give the medicine, the new growth of the leaf has to be fast, because if that leaf falls down, the new growth has to be there. I have seen few remedies. First, I have, if you have that remedy, you do think about that remedy. That is coriander. I have used coriander in 12 potency, which have given me good results. Second, I have used Azadirachta indica, which have given me good results. Third, I have used a very, very interesting remedy. I don't know whether you have ever used, that is Ichnisia angustifolia. And fourth remedy which I have used in my practice is Osimum, Tulsi. So these four remedies have given me good results in those cases, not lot of cases, but few cases which whatever I have prescribed, I have got the results. Please explain about melasma. Yeah, welcome Dr. Diya, Dr. Amulya. So melasma. Now see, when there is discoloration in the face, especially black, and the patient comes to us, of course, let me tell you, for me, it is also very difficult to treat. And if those cases also come, it is difficult for me to treat. No, as a director, not in mother deterrent potency, 12 potency. Let me just tell you one thing about melasma. If the discoloration of the face is blackish, few remedies which have got very, very good results. You can write down those remedies, First is China. Second remedy, again, very, very important, is Onentha crocata. Third remedy, lachesis. And fourth remedy, I think I have told you before also, Corallium rubrum. These four remedies have given you very, very good results. Of course, there are other remedies also, like we have mercury, we have sepia, we have phosphorus, we have sorinum, we have phosphoric acid. But these four remedies, Corallium, Onentho crocata, China, lachesis, have given me very, very good results in my practice. And you can also try. Of course, in melasma, case taking is very important. When you take the case, and in the case taking, you find some very, very interesting symptom which defines the whole personality, and it is not defining the melasma, take that symptom for prescription. It is hardly important whether the patient has melasma or tumor, but your case taking and your individualization and your repertorization, if it comes in the repertory chart, differentiate that with metermedic, and you will get basically good results in case of melasma also. Okay, nothing is impossible. Only the limitation, as I always say, is that homeopathic doctor himself and not the pathy. So be very confident. Yes. Can we have few more questions? Hemorrhoids. Hemorrhoids, Dr. Amulya, so many remedies, and see, in hemorrhoids, what will I tell you? You start from A and you go to Z, every remedy can be thought of, Of course, there are few remedies which are very, very important. Those few also so many, if you can, and we have seen in hemorrhoids, like we have bleeding hemorrhoids. Think about hemophilis, think about phosphorus, think about lachesis, think about collinsonia, think about carbo wedge. These are all hemorrhagic remedies. Now, blind piles, which I have seen, very, very important. Think about esculus, think about peonia, think about Kalikar, think about Naxomica, think about Graphitis, Lycopodium, a lot of remedies. Whenever in practice, when we were taught, we were told, if there is bleeding piles, think of hemophilis. If there is blind piles, think of esculus. Of course, you can't treat the whole piles with these two remedies. But then these are the symptoms. Then of course, ask how is the bleeding, whether there is pain, which type of pain, what time, before stools, after stools, in the morning, evening, night, and then you'll be able to understand and treat piles better. But there are a lot of remedies. I think hundreds of remedies. Welcome, Dr. Subhasa. So I hope you are getting results. What I'm teaching in my YouTube live, that is very important, so that I also know that whatever I am teaching you have given you good results. So whenever you get results and whenever you are getting good results with our YouTube live, please share some of the cases so that we all learn with you. Please give some remedies for uterine fibroid. Dr. Shailesh Kumar. Uterine fibroid I think dealt in last YouTube, I think before YouTube lives also. Common remedies that you should always remember Fraxinus americans, remember Thalaspi bursa pastoris, remember Conium maculatum, remember Calcaire floor, remember Ficus religiosa. These are very, very common remedies. Of course, then you have to think about symptoms. How is the bleeding? How is the color of bleeding? How is the quality of bleeding? Whether the clots, whether the blood is like watery, whether the blood is thick. See, there are a lot of things, but these 4 or 5 remedies very, very common in cases of uterine fibroid. Inherited asthma in 29 years, chilly man. Inherited asthma, I have already told you some of the remedies, and it is inherited, so do go for the case taking. Case taking is the crux of homeopathy, and this is how you will be able to cure the cases. Just by I could tell you the remedy, by what is there, but I would be happy that if you give me some other symptom that defines the whole personality. That is basically a crux of homeopathy. Now, hereditary, there are remedies. I think I had told you few remedies also, that hereditary asthma. I think if somebody will be able to answer this. Inherited. The patient has inherited asthma. Iodine is there, calcarea is there, sulfur is there. There are so many remedies. Don't go to the mater medica, but go for the case taking. Sir, I had a typical case of gallstones, all symptom matched and remedy was MacFos, but patient was hot, specific thermals. Question asked how to approach the case. In gallstones, as I told you, I have given you some acute remedies like I have given you Filtauri, the cholesterinum, Carodusmar, Berberis vulgaris. These are the very, very common remedies. But in gallstones, the acute remedies. But if the patient is hot, then you have to take the case and take the symptom of the patient as person and not depending only on one or two symptoms. Okay, and acute remedy I have told you, so try that. Sir, tendon torn, Silesia 6 years back, no particular except fear of jumping and carrying in persons least bothered. Hertz told me he's giving me 1 year or else we'll go for surgery. I had cases, of full ligament torn. The ACL was torn. And of course, case taking was done. Remedy prescribed. I prescribed the patient calcarea carb. Calcarea cap 200 I prescribed first. I think I gave twice a month. Then calcarea cap 1 twice a month. And in one case, I had prescribed immediately. The patient came to me, Ruta and Bellispur in LM potency. Repetitions. Very, very important. Ruta and Bellispur and calcarea floor. These 4 remedies have given me most of the result in case of ligament injuries. Do try Ruta, Bellispur in LM potency. Repetition will give you very good results. In fact, in next YouTube live, you will tell me that, sir, the patient is improving. This is how basically you have to approach. Sir, how to approach cases where there is paucity of symptom. See what Dr. Hahnemann tells you about in organ of medicine, one-sided disease, when there is paucity of symptoms, Of course, whenever there is paucity of symptom, if you ask me, I will always tell you when there is paucity of symptom, that means your case taking is not proper. Or if there is paucity of symptom, ask the patient about his daily lifestyle. How does he behave? How does he talk? How does he eat? How does he drink water? Which type of clothes he wears? How does he go in the office? How does he behave with his attendants? How does he behave with his boss? Or how does he behave with his subordinates? If you ask the symptom to the patient, automatically the patient will tell you his routine, because he will never forget this routine. And from this routine, your case taking, you will interpret some symptoms and you get the remedy. So paucity of symptom is basically, sometimes I feel the doctor is not able to explore the patient properly. Fever tendency in 2 colleagues, young students. Tendency to recurrent fevers. Tendency to recurrent fevers. I had told you one case in a YouTube, Dr. Pandey. So do listen to my YouTube videos very properly. When I finish, again go and read, again go and hear, because sometimes I'm very fast and you miss what basically I'm telling. So in recurrent fevers in children, I told you the remedy which I gave normally is carcinosin, which has given me tremendous results. Recurrent fevers, that is very important. Carcinosin. I will do the needful, both alternative BD. No, not alternate BD. Take some symptoms of Ruta, take some symptoms of Bellispur, don't alternate it. One remedy at a time, no 2 remedies at a time. And then you will get the symptom. LM potency, you can repeat. See, in these type of cases, I have my experiences there. Repetition gives you good results. And let me tell you, if you prescribe one of the remedies, Ruta, Bellispur, calcarea floor or calcarea carb, you will get results in a week. And you will WhatsApp me, sir, I have started getting results. Continue that remedy. It will be a very good learning for you also, and will also enjoy, and you share your experience that the patient, I'm dead sure the patient will improve. No need for surgery. Sir, how to reduce LDL cholesterol with the patient doing exercise and having diet? See, don't worry about the LDL, the HDL, the ratio. Once the total cholesterol goes down to normal, automatically all the parameters will go down to normal. There is no specific case taking for reducing LDL cholesterol or HDL cholesterol. The whole parameter has to, the whole cholesterol, once the cholesterol is okay, everything will be okay. If the cholesterol is not okay, then every parameter will rise. So treat that cholesterol, treat the patient suffering from cholesterol and not the cholesterol. As I told you, and I discussed the case of a doctor, which she was there on the YouTube live. Her husband cholesterol was so high. Just one dose of lycopodium 200, after 2 days, the cholesterol came to normal. And the good part was that the doctor which was there in a YouTube lab, she is a homeopathy doctor and her husband is an allopathic doctor. And he also was so surprised that the cholesterol came down to normal in 2 days. This is the art of case taking and prescribing. I always tell you the case taking has to be very good, and then the interpretation. If you are not able to explore the case taking, ask the whole daily routine. What do you do? What do you do when you get up? How do you brush your teeth? How do you go to your job? How do you treat your subordinates? How do you treat your family? He will tell you, and from that you can always take the symptom and go for interpretation. You will get the symptom. No need to be very serious and keep asking, yeah, what is your nature? What is your nature? Just be very casual in your case taking, and you'll get the answers. Some remedies for status dermaticus. See, there are so many remedies for status dermatitis, Dr. Muli. Maybe next time I'll tell you, because these remedies I'll tell you, but in these cases, case taking is important, because sometimes those are autoimmune disorders, and case taking becomes very important. Dr. Amni, good afternoon. We have just finished the session and you're joining. So it's already half an hour up, and next time, maybe we meet next Saturday in our next YouTube live. Until then, thank you for joining and thank you for your time. Thank you so much.